health as a bridge for peace. Now there it was recognized the role of physicians and other health workers in the preservation and promotion of peace is the most significant factor for the attainment of health for all. World Health Assembly Resolution 1981. Now just get a little bit of idea about how this concept came forward. Now historically, in 1980s, 70s and 80s, there were many struggles and guerrilla wars in Central and Latin American countries, including Salvador, Chile, Argentina, so on and so forth. And there's a branch of World Health Organization which is known as Pan American Health Organization, PAHO. They have had a health-based approach. Now, when the wars are there, guerrilla wars are there, provision of healthcare is being affected to a large extent. So they have requested both parties to have ceasefires to give immunization. In fact, we have used this concept in Sri Lanka in 1995 when we launched the first immunization day for polio. We got the international Rotarians, international organization, WHO to reach unreached areas in northern province. So this concept has been there. And so as a result, as I said earlier, in 1981, World Health Assembly has institutionalized, taken a policy decision that this is a very good approach. And then, of course, in 1997, it was discussed in World Health Assembly in detail, and 1998, 51st WHO World Health Assembly, it was accepted as a good policy. And 21st century, we are practicing it in many countries like Mozambique, Croatia, Bosnia, Sri Lanka, and Angola. Now, it's not only that there's Geneva Convention to protect healthcare professionals, and war situation I have had fortune to travel everywhere in the country, conflict-affected areas as well, we never attacked. And all the healthcare professionals were protected by all the parties. So that's another advantage of healthcare professional and approach in health, where we can provide the services without any disturbances. And health and peace, again, it is very important. As you know, diseases will cross the borders, no visa needed, and all the parties will be affected. So therefore, in the concept in peace building, if it is incorporated to health in practice, of course, we can solve many conflict situations. And health is the perfect branch which is acceptable to almost all people. Now, just coming to the situation in the northern province, there are 161 preventive care institutions, and there are about 92 curative care institutions. Now, as you know, when the humanitarian operations have been started in northern province, there are a lot of displaced people. So ministry as a responsible organization to provide health care, we thought that we should get involved right from the beginning. So we have visited the area, and then we have set up a committee. I think most of our speakers have been, actively involved with the academia as well. And this committee was chaired by Director General of Health Services to ensure provision of healthcare services to IDPs. And then, of course, as I said, we have started 24 hours operation of the disaster preparedness and response unit in the Ministry of Health. And then, of course, we have set up a unit in the Chetikulam, and I have been the first person to go there to start it. Now, when it was started, of course, there were a lot of casualties. We had to evacuate them. And we have did it, with the armed forces and ICRC. We evacuated the patients from Kilnochi Mulathiv areas to Trincomalee Hospital, Pulmude Hospital. We have set up new hospital with the Indian assistance, and they were evacuated. And thereafter, of course, we had to refer them to various other hospitals. As usual, when there are thousands of casualties, we can't cater them in few hospitals in and around. So that we have recognized hospitals, about 2,000-3,000 beds in different healthcare institutions in Polonnaruwa, Kurunegala, various other districts, and we were referred these patients to those places, and they got the best treatment. Now, IDP situation in Chetikulam, of course, when suddenly there were about 280,000 people who were displaced, were brought into one location, which is Chetikulam in the Vaunia district, and there, of course, we were given the task to provide a holistic health care. to these IDPs. We have taken the challenge. And we have set up the primary healthcare institution, preventive healthcare network, secondary care, tertiary care, rehabilitation, all that had been set up, the mobility, all that had been looked after there. Now, when we started the provision of healthcare, of course, there were a few institutions close by. The major hospital which was there was General Hospital Vaunia, and it was a hospital at that time like a base hospital with few consultants, 175 beds. Within matter of 2 weeks, we were able to increase the bed capacity to 400. And we pumped a lot of money to provide equipment, and we have mobilized all the healthcare professionals, including consultants and nurses, and all the unions and other provincial directors, all made their effort to see that this is successful. Then, of course, there were certain other institutions in and around. We upgraded those institutions. Then there was another institution in a close vicinity. That was hospital, Chetikulam Hospital. It was a district hospital manned by 1 medical officer and 1 nurse. And how to look after the IDPs. Within 1 week, we were able to transform this whole institution to a separate institution, to a level of a base hospital. We have taken over the labor room, and it was with little modification converted to a theater. And then, of course, we have done a lot of things, temporary huts and all that to accommodate patients. Then, of course, we have upgraded all these institutions. And within the IDP camps itself, of course, we have set up the daycare centers. I don't know, my time is limited. I have a lot of things to show. But anyway, time is not enough. We have started mobile clinics. We have provided the ambulance services. We have set up mobile diagnostic facilities. Then, of course, home visits in the night, because daytime they were engaged in the provision of care. Night we started visiting home because there were elderly people at those camps. Then, of course, we didn't have enough ambulance. We had whatever we had, we provided. But then, of course, we have a little bit of modification to the three-wheeler. We made it ambulance, and this was sent. We have had such facilities as well, locally modified ambulances. And then we have established our preventive healthcare services. And so all these we have done very well. This is a landmark thing, immunization. As you all know, the people who were there in the disturbed area, they were not immunized. Some places, so we thought that we should have one-day program. One-day program, mind you, we had 39,000 children to immunize within a day. We have mobilized 450 midwives, 100 PHIs, and WHO, UNICEF helped us. And within a day, we given each and every child polio additional dose of vitamin A, and measles vaccination with the, in fact, Madam was there as an advisor to us, and we have done it. And this is the first time in the history, in IDP situation, such a thing has happened. And it was recognized in the global community. And health education was attended. Then, of course, it's not only provision of care, we have attended rehabilitation as well. We have started fixing of limbs within the IDP camps. I think Professor Amar Singh was there with us sometimes. He will vouch for us. And we have set up other vector control measures as well. And then the mental health promotion, recreational facilities, all that have been attended. And so ex-combatants were looked after very well. And morbidity, a lot of people came with, thousands of people came with hepatitis outbreaks. Patient came with chickenpox. That's the first time we used antiviral drugs for chickenpox. And within 1 or 2 weeks, we were able to bring it down. And thereafter, no diarrhea or no other outbreaks. And then SPEAR project, and this is what is set in 1997, a committee has been set up to identify minimum standards. And we were doing extremely well. We were well above the minimal standards. Mortality rate finally became 0. And I have no time to go through. And this is the commitment of the government of Sri Lanka, head of the state. His Excellency the President was there in Punrin Hospital to lay the foundation stone to put up the infrastructure facility. And we have given additional allocation of money, human resources, capacity building, provision of vehicle, all that had been attended very well. And this is how we have given the money. Additional resources were given. And government of Sri Lanka has spent more than 2 billion rupees, 2.5 billion rupees for this. And thereafter, we took the challenge of resettling people, and we have sent now almost all the vacancies, northern province is been now filled. So we have taken so much of measures to ensure provision of care now. If you compare the health sector indicators, northern province is now very much better than some of the districts outside northern province. So, so many things to show, madam, but I have no time. Those are very good photographs to show, but we have done a lot of other work. I involved with IKEA also. We have set up the best eye unit in the countries in Jaffna Hospital now. And these are the organizations who have helped us. And finally, I ended up with these all the rehabilitation work we have done. So, only 1 minute, madam. Just I will say only this. I don't know whether it's yet to come in, but I am strongly confident. This is a success story of achieving peace and reconciliation through health and development. Thank you very much, ladies and gentlemen.